First it was cholera.
Yeah, good morning.
Now South Africa is facing
Africa.
what?
Wake up African time. Of course, you know that Africa is waking up across the nations or wherever they are scattered or domiciled. They are waking up through their speech, through their alignment, through their alliance, I may say. But there is some intelligent report that I'm actually getting for the past week. Because most of this intelligent report, they come as a code that you need to report. You need to actually uncode it. There is something I just saw where they say German cockroach is making their way to Africa, and then we're in Africa, in South Africa to be precise. It wasn't long enough. Remember that this German cockroach, before it was reported, is already in South Africa. So the report just had it that it is making its way to South Africa, but it was not the case because it was already there in South Africa. Now, that's why you heard the outbreak of cholera. It might sound that it is government carelessness. It is part of it because they are not proactive in order to understand the intelligent report or actually to follow up, with health emergencies. But this time around, I want to tell you the secret. The secret is that every country in Africa that has supported the Russian, China, etc., they are going to get the fair share of what they are planning for them, because of course, remember that Africa was positioned in a way that it will never wake up, that she will never wake up from their slumber. So whenever the time they have started waking up, that's why you will begin to see news like this.
First it was cholera. Now South Africa is facing what probably shouldn't be called an outbreak just yet, but it is diphtheria. KwaZulu-Natal and the Western Cape have confirmed several cases in their province. Diphtheria is a contagious airborne bacterial infection. Professor Anne van Gotberg is a clinical microbiologist with the National Institute for Communicable Diseases, and she joins us now to explain this further. Prof, thank you so much for your time. She's speaking to us virtually from Johannesburg. NICED has called for healthcare workers across the country to just be very aware for these symptoms, but said there's no need for panic. Do we have an update with regards to the number of confirmed cases that we do know of as yet?
Yes, so we only have two confirmed cases, one from KwaZulu-Natal and one from the Western Cape. And you're right, what we're trying to do is create awareness so that clinicians can be on the lookout for the clinical presentation. It's an upper respiratory tract infection, but where the children really have a swollen neck and have difficulty in breathing. So it's quite distinctive. It may present a little non-specifically right at the beginning, but if clinicians are aware that this should be part of the differential diagnosis, they can then send specimens to the laboratory to exclude diphtheria.
Now, Prof, you spoke about the swollen, a swollen glandular looking symptom, but I also know that here in Johannesburg, doctors have warned about a little outbreak of mumps at the moment. Would it be possible to confuse the two symptoms?
Yes, I think initially it's potentially possible that the two might be confused, but I think there are other signs. With diphtheria, there's a real, it's a sore throat, the weakness, a fever, a low-grade fever, and then the respiratory tract becomes obstructed. People can't breathe, and I think it's very distinctive. I think mumps is a self-limiting disease that may have one or two features that are similar, but the clinicians, the doctors and nurses out there will definitely know to investigate and to consider these diagnoses and to take the right specimens to help us to make the diagnosis.
Now, there are vaccines that children are supposed to receive within the first year of their life against diphtheria. Are you and your team surprised by this cropping up? I don't know if we can call it an outbreak just yet. What are we calling it, and are you surprised by it?
Well, strictly speaking, yes, we are calling it an outbreak because it's above the number of cases that we'd be expecting. So I think it is an outbreak. We're not entirely surprised. Vaccine coverage did go down during the pandemic. And what we're really trying to urge is that parents and guardians take their infants, the little ones, for their due doses. So the 6, 10, and 14-week doses, as well as the boosters then at 18 months. But we're also asking anyone who might have missed doses to present to their clinics and hospitals with their parents, their guardians, to come forward so that we can do catch-up vaccinations. So it's a vaccine-preventable disease. It should not be occurring in South Africa, and we'd like to increase the coverage of these vaccines so that we can prevent these diseases.
Are those that are in danger specifically younger children and babies? Who really should be on the lookout for these symptoms?
Well, in fact, the one case was an adult. The other case was a very young infant. So at the moment, I think we need to be aware of this disease in all ages. If the vaccines are given to the infants and young children and the boosters at 6 and 12 years, then we should hopefully have immunity within all ages. So at the moment, I think I would be aware of this disease in all age groups. Obviously, little children, infants, have more severe outcomes for most diseases. So we do worry with them especially. But I think it's very important that this disease is considered as a differential diagnosis, but also that we try and improve all vaccine coverage throughout the country.
Now, Prof, I recently found out that hand, foot and mouth disease crops up amongst in creches and preschools every year or so. It's new because it's my first child and it's a toddler that's at school for the first time. And when I saw the message come up on the school WhatsApp group, I was like, wait, this is actually a thing. And it's almost like if you don't operate within those circles where this thing crops up every year or so, I'm told that you're not actually aware of it. What kind of awareness should we be putting out there in terms of how quickly something like diphtheria can spread? And is it preventable through sanitizing, through keeping kids at home if they're showing symptoms and that kind of thing? What other preventative measures, other than making sure we're up to date with our vaccines, should we be aware of?
So after the pandemic and the knowledge that everyone has related to respiratory-borne diseases, I think many people are now experts and many of our public are experts. So it's exactly as you point out. It's a respiratory disease. It's non-pharmaceutical intervention. So it's social distancing. It's staying at home. It's having meetings or meeting outside if you have to meet. It's wearing masks sometimes if you really want to protect someone at great risk. And so I think it's exactly the things that we were doing for the pandemic. Those things would hold for all of these respiratory viruses and bacteria. So I think people have learned what to do. It's to hold to them and to, when symptomatic, I think very importantly, to keep children at home for the few days that they're symptomatic, for us to stay at home when we're symptomatic as adults and not to go to work. If we do go to work, to remember to open windows, to have your office, especially if you're in an office alone, that's also good. So I think to keep to all of those very pragmatic and practical methods of trying to prevent respiratory transmission.
Okay, great. We're going to leave it there. Thank you so much for your time. As always, you and your colleagues always readily available to help us figure out what to do next. That's Professor Anne von Gottberg, a clinical microbiologist with the National Institute for Communicable Diseases. 2 confirmed cases of diphtheria, a child in the Western Cape and an adult in KZN, if I've got that right. Diphtheria, the NICD says, is uncommon, but vaccine-preventable infection that spreads through respiratory droplets from coughing or sneezing. And like she said, we've learned so much from the COVID pandemic, so it's important for us to remember all of those lessons that it has taught us so that we can continue to protect each other and especially our vulnerable and keep them safe.
Now in this news, you will see where it says the outbreak of cholera, the outbreak of Marburg virus. Now there is also other news that talked about COVID variant and the diphtheria. So there are many viruses, there are many ailments that is actually making its way to African borders. And it is important for you as African in Africa to know that you are targeted because you are waking up. That is the last battle before we get our freedom. So it is up to you right now to wake up and actually make sure that you take the necessary protocols to protect yourself from this image. So of course, some of your leaders, of course, when you look around you might see that so many African leaders, they are still not, understanding what time is it. The time right now is the time of the last war, because we are the forgiving generation in this fourth industrial revolution, because you have to understand that in the next revolution, it is going to be Africa ruling the world. So that's the reason why these enemies of Africa, those who want to keep Africa on a periphery, they are actually fighting back, because anything that will bring a paradigm shift or power shift to Africa, to the world, they don't want it. They want to continue to implement their imperialist strategy to hold Africa down. But the only way we are going to fight this, it is actually to make sure we continue to break barriers. Everything they have instituted in Africa, we are going to actually uproot them. That's one of the ways we will be able to get our freedom. We shouldn't wait for the international investors to come in and buy the state-owned companies, the state-owned businesses, because they will have upper hand. They will control the state, because there's something that African people don't understand, because it is in Africa that they wait for foreign investors. When these foreign investors come, there is a means to sabotage what the state own in order to buy it all and have the monopoly over it. From there, they will control the state. From there, they will bribe and they segregate the members, or in the leadership positions, they segregate them with bribery and corruption, because they want them to sabotage one thing or the other in order for them to actually own it and privatize it. Very important, something that you need to understand, that we are in a last battle of freedom in Africa. Of course, we always tell you freedom of Biafra is freedom of Africa, and it is not a joke, because we are actually the ones who knows and understand the intelligence report when we see them, and we are very, very proactive in protecting our people. It is, of course, we are a part of the African Unity Initiative, but African Unity Initiative, we are also part of Africa destroying every structure of imperialist that is actually destroying the lives of the people, or actually, using the blood of people to make Europe great, rather. So it is important for us to know and understand that we must destroy every imperialist power and the structure implemented in Africa. It is the reason why they are controlling us. They are controlling our healthcare system, control everything.